we've made a specific effort to make sure that their faculty includes nurses as well. So the first faculty on stage is going to be Anitha. Swarna, can you please introduce her?
Sister Anitha is a senior sister. She's a committed and highly skilled nursing professional with over 2 decades of experience in perioperative and surgical care. She is currently serving as a nursing officer in the Department of Operation Theatre in Medical Sciences in MGM Healthcare, Adayar. She began her career at Apollo Hospitals, Chennai, where she worked for nearly a decade as both the staff nurse, charge nurse, and in the operation theatre. During this period, she gained extensive hands-on experience assisting in a wide spectrum of surgeries, including general ENT, laparoscopic, plastic, gynecological, and vascular surgeries. Known for her dedication, precision, and compassionate approach, Mrs. Anitha has contributed immensely to surgical nursing, ensuring the patient's safety and excellent and perioperative care. Over to you, sister.
Good morning, everyone. Today's topic: how to set the lap instruments for lap cholecystectomy. Actually, our OT nurse, we have to keep ready for lap-based laparoscopic cholecystectomy lap instrument. At the same time, small open instrument. Then a camera, light cable, monopolar, bipolar cable, then gas tube, everything to make it ready. Some hospital we have centralized connection for CO2 insufflator. Some hospital we have cylinder type insufflator. So you have to make sure everything is ready before starting the case. Our circulating nurse open the second layer of the sterile laparoscopic set, outer layer of the instruments. Our scrub nurse has to open the inner layer of the set. After open the drapes, you have to check the sterility. This is Varys needle. Manually, we have to check the spring action of the Varys needle. Then we have to patency of the Varys needle with flush with the saline. We have keep 2 types of Varys needle. This is 11 mm trocar for camera and operating port, trocar with the cannula. Then 2 11 mm trocar with the cannula, 6 mm trocar with the cannula too. If some hospital we have disposable or metal one. This is port closure with close the port. 10 mm reducer for passing the 5 mm instrument. This one 200 clip applicator to clip the cystic artery, 300 and then 400 clip applicator. Before starting the case, you have to check that maybe it should be tight. We have to check according to the surgeon's convenient. You have to give the handle clip applicators. 10 mm clamp forceps to hold the gallbladder. This is 10 mm. Then 10 mm stone holding forceps to remove the stones. Maryland dissector 5 mm to dissect the Callas triangle. Then tooth, non-toothed grasper. Then cutting scissor. Then 5 mm hook to connect with the monopolar cartridge. Spatula to connect with monopolar cartridge. This suction tip 5 mm. Monopolar cable will make sure it will be connect properly, it's not to be loosened. Then bipolar forceps with the cable, have to make sure the 10 mm 30 degree scope and 5 mm 30 degree scope. This one for gas tube and suction tube and irrigation tube all together in one pack. You have to keep it ready. Then flask with warm saline for scope cleaning. So the circulating nurse, we have to use that camera for camera cover. The circulating nurse will wipe with bacillol or isopropyl solution. The scrub nurse get the camera to the drapes. If you have plasma sterilization, you will keep it in plasma for camera light cable. But for lap cholecystectomy, we can use with the camera cover. For a light cable, we have to fold it before, not like the camera. If the light cable, you have to fold it closely. It will be easy to access to get the light cable in. It will be easily, it will come. So you have to fold it before getting that light cable. So make sure everything is ready. No need to tie it now. Then BP handle with the blade, we'll keep it in the kidney tray. Lined gas will get the counts 1 or 2 times to the circulating nurse. That Vicryl for port closure, 10 mm port with the port closure needle. Clip applicators, then sutures, flask, endobag. This not only the regular case, that all the acute cholecystectomy, you have to get ready for all these instruments. For endoloop, harmonic, then endobag, everything. This is for remove the gallbladder. 10 mm scope and 5 mm scope will make it in the Sidex OPA solution. Connect the camera and light cable before starting the case. Then painting, draping. After the draping, you have to keep the camera, light cable and monopolar bipolar cable, everything in the proper position. After the timeout, you have to start the case. When the scope clean with warm saline. Whenever passing the instrument, you have hold the trocar and give. The surgeon convenient, you have to give the clip applicator. That some surgeons will use 2 clips in this, hold up, down, up the handle. The third one you can hold, sometime will hold down the handle. The 5 mm instrument will introduce with the introducer. After the surgery, we have to dismantle all the instruments. Always the sharp will take with the artery forceps, not in the hand. The dismantle all the instruments, lap instruments. Every instrument you have 3 parts, that rod and insulator and then handle. So everything you have to open, and the soft instrument keep it separately, and the draw that like clip applicators you have to keep it separately. All the instrument you have to reassemble. Then you had wash with the 3M multi-enzyme solution for 1 liter in 10 ml. After just washing the instrument with the plain water, keep it in the multi-enzyme solution, wait for 10 minutes. The tips of all the lap instruments will with the brush. Then washing with the running water. The channel kind of instruments, everything flushed with the syringe and saline. Then wash with the running water. The trocars and cannula have to reassemble the cannula and trocar, multifunction valve separately, washer separately, everything wash separately and keep it in the plain sheet. Then we have to make sure everything we have to need to dry with some hospital we have that air jet. We have to remove all the fluids inside the channel kind of chambers. We have to wash all the instrument, then packing and send the instrument to CSST.
So explanation is very good.
Yes, ma'am.
Ma, this is a good platform for ask any doubt. It's a OT nurse. You should have some questions in your mind. Please.
Even sterilization, yes, boss.
I am Prima, working in Dr.Vidya Institute. I have a question that sterility will be the main thing here. The patient who will be admitted for the private center, they will be paying more money compared to the government hospital. Why are you using, Sidex and the camera cover for the such a difficult surgeries?
If we have
and you have the options, you can sterilize the scopes and you have plasma or the E2O, but you can do the plasma for the 20 minutes.
I told you before, if you don't have plasma sterilization, no other option to use. If in case we are sending the scopes into the ETO, it will definitely be break.
If you have the steroid, you can use it, is it? Or else you can put it into
if they don't have
but still, if you're using the camera cover, you cannot, completely cover the camera with the scope.
No.
And you are using for the light source also for camera cover.
Everything we have to cover, no, only outer the cover you have to connect with the camera, no, then how
After the scope you will cover, or how it is? It's difficult to manage when you being, rotating the scopes and the camera.
past 10-20 years we are using the camera. We didn't face any difficulty with along with the camera cover. Some hospital we have plasma sterilization. You are right, we have, but continuously we have 3-4 cases in between time once it's a matter. Then for surgery, it will be for lap chole or appendix, you can use with the camera scope with the side XOPA. If I said right, if in case of neuro or spine arthroscopy, that case will have that, if everywhere you have plasma sterilization.
No, it's totally disagree, because it's compared to the neuro and the heart, the neuro and the orthopedic.
Your
it's
point
more
is extremely
important
well taken, Prem.
Yeah.
The reality of India is 90% of the hospitals do not have plasma.
No, it's
do
not
have
about
a
the
plasma
90%, because we have seen that, because I have been traveling for the 30-35 hospitals, because I never seen these people are using still like this, because it will be the young generation to be modified. They should not follow this for the future. So that's why my questions.
Okay,
No, your point is well taken. Your point is extremely well taken.
And it's and the one more thing is I would like to convey. It depends upon the for the lab chole we need such a many instruments to be in the table.
Yes,
So,
all the instrument you have to keep it. In case acute chole, you have taken the 2 extra tooth forces. Only the needed things I shown to that video. For these instrument enough for lap cholecystectomy.
yeah, I think interesting conversation here, discussion here. Mr. Prem made an important point, and Dr. Anitha sister also made a very, very valid point. See, the take-home message here is, we are in India. Okay, if you are in States, many of the things will be done differently. Many of the instruments would be use and throw. Okay, so many things. So it's not possible in a country like this. So we have adopted, in India we have adopted to various, to make sure that the surgery goes on at a very, the cost also doesn't go out of hand. That's a very important factor in India. So here what we have done is, we have adopted to a system, and sisters have so, tuned it to such an extent that we are able to do surgeries without having to use and throw the instruments in a very, very safe way. So yes, Mr. Prem made an important point that many things that we are doing are not their best, but with this type of expertise that our sisters have developed over many years, we are able to give a very, very safe and almost equal results to what the Americans or any Western countries can give. So what sister showed is absolutely acceptable way of doing things. It's not the best, but it's a very, very acceptable way of doing things. But we have to be very, very careful. The way that the camera cover is being introduced, the way that the light source cover is being introduced, it has to be done very, very carefully. Otherwise, there will be compromise of asepsis. So this is a good way of doing this. It is acceptable, although it may not be the best way of doing this. But in India, this is totally acceptable. You have to really be very careful in doing this.
So, sorry, I'm just making a comment. I'm Dr. Sudhita here. So absolutely right, like sir told. Yes, a training program, we should know both. We should not tell this is a corporate hospital. This is not corporate about corporate. This is about a training program. We should know both. One, regarding the instrument, even I'll be interested to keep another needle holder in the table, because I don't want my nurse to run for a needle holder when it is bleeding. So gauze pieces and needle holder is always there on my table when I do laparoscopy. So instruments, even we at laparotomy set, you may not open, but it should be next.
Yes, sir.
Because you should not, if it is bleeding and you are converting, you should not run and get it. So these are the things we should, keeping 2 instrument extra is not going to hamper anything, but it helps at the time of need.
No, sir. Actually, all the instrument, extra needle holder, extra tooth forces in the sets. For the video sake, just I have for
I appreciate,
easy.
I
Yes,
appreciate, absolutely appreciate. Even a hemolog.
all together in one set, sir.
Yeah, thank you.
Thank
Another
you, sir.
important point here is about the side X. The side X is, the solution is a very, very powerful antimicrobial. But the thing is, it has got a very, very limited shelf life. Suppose if it is mentioned that it expires on this and this date, you have to really change it. You keep on having the side effects for months together. One, it doesn't work, and two, it becomes a source of infection by itself, especially something called atypical mycobacterial infections. The important thing is, whenever you use Sidex, you have to dip it in, normal saline many times, multiple times. Even if there is a drop of Sidex in the instrument channels, and we tend to, if we use those instruments, patient will come up with a non-healing sinuses and other problems. So it's very important to make sure that the instruments taken out from Sidex are dipped very well in saline multiple times before, and then use a cloth to dry it off, and then only should hand over to the surgeons for usage.
We have a checklist before starting the laparoscopy case. Sidex OPA indicator, we have to check the indicator, then only put the scope into the Sidex. We are maintaining the protocol. Every 14 days we have to remove the Sidex, but before every case we have to check with the Sidex OPA test strip. Any other questions?
Thank you, sister. Thank you, faculty. I'd like to have Rajati sister from Madurai Medical Mission to felicitate Anitha sister on the stage, please.
I think the internet hasn't caught up with Anitha. Anitha is the OT manager and in charge of MGM Healthcare Malar.